Arthritis. You're treating it wrong. See how to actually repair cartilage. Arthritis, a condition characterized by inflammation and pain in the joints, affects millions of people worldwide. Common treatments often focus on managing symptoms through medications and lifestyle changes, but these approaches may not address the underlying issue: cartilage damage. Recent advancements in research suggest that it might be possible to actually repair and regenerate cartilage, offering hope for those suffering from arthritis. Here's how to shift your focus from merely treating symptoms to actively repairing cartilage. Understanding cartilage and arthritis. Cartilage is a flexible, connective tissue found in joints, acting as a cushion and enabling smooth movement. In arthritis, especially osteoarthritis, this cartilage wears down over time, leading to pain, swelling, and decreased mobility. Traditional treatments and their limitations. Traditional arthritis treatments include pain relievers. Medications like NSAIDs, nonsteroidal anti-inflammatory drugs, help manage pain and reduce inflammation but do not repair cartilage. Corticosteroid injections. These can provide temporary relief but may weaken cartilage and bone if used excessively. Physical therapy. Exercises improve joint function and strength but do not directly address cartilage repair. Surgery. In severe cases, joint replacement might be considered, but this is a last resort and does not restore natural cartilage. Revolutionary approaches to cartilage repair. Nutritional support. Certain nutrients can support cartilage health and potentially aid in its repair. Glucosamine and chondroitin. These supplements are often recommended for joint health. Glucosamine helps maintain cartilage structure, while chondroitin helps retain water in the cartilage, making it more elastic. Omega-3 fatty acids. Found in fish oil, omega-3s have anti-inflammatory properties that can help reduce joint inflammation and pain. Antioxidants, vitamins C and E can help protect cartilage from oxidative damage. Regenerative medicine. Regenerative medicine focuses on repairing or regenerating damaged tissues and organs. For cartilage repair, several promising techniques are emerging. Stem cell therapy. Stem cells have the ability to differentiate into various cell types, including cartilage cells. Injecting stem cells into the affected joint can promote the growth of new cartilage. Platelet-rich plasma, PRP therapy. PRP involves injecting a concentration of a patient's own platelets to accelerate the healing of injured tendons, ligaments, muscles, and joints. Platelets contain growth factors that stimulate cartilage repair. Tissue engineering. This involves creating bioengineered cartilage using scaffolds and cells. Researchers are developing methods to grow cartilage in the lab and then implant it into the damaged joint. Exercise and physical therapy. While traditional physical therapy focuses on strengthening the muscles around the joints, specific exercises can help stimulate cartilage growth. Low-impact exercises. Activities like swimming, cycling, and walking can help maintain joint mobility and reduce stress on the cartilage. Range of motion exercises. These exercises improve flexibility and reduce stiffness, promoting joint health. Strength training. Strengthening the muscles around the joints can help reduce the load on the cartilage, potentially slowing its degeneration. Lifestyle modifications. Certain lifestyle changes can support cartilage health and prevent further damage. Weight management. Excess weight puts additional stress on the joints, accelerating cartilage wear. Maintaining a healthy weight can reduce this stress. Anti-inflammatory diet. Eating a diet rich in fruits, vegetables, lean proteins, and healthy fats can help reduce inflammation and support overall joint health. Hydration. Staying well hydrated helps maintain the elasticity and lubrication of cartilage. Treating arthritis is not just about managing symptoms, but addressing the root cause: cartilage damage. By incorporating nutritional support, regenerative medicine techniques, targeted exercise, and lifestyle modifications, it is possible to promote cartilage repair and improve joint health. These approaches offer a more comprehensive and hopeful strategy for those suffering from arthritis, moving beyond symptom relief to actual healing and regeneration. If you're struggling with arthritis, consider exploring these options with your healthcare provider to create a tailored plan for repairing and maintaining your cartilage.